Awesome. Okay. All right. So thank you, Heather, for being here today, and I will let you start. Hang on, you're on mute.
I said I don't usually prepare for my presentations all that much, except for you know, more professional type meetings and stuff like that. So with students, I prefer like more of a question answer, ask me questions, things like that. But I'll start off with saying that I'm the Associate Director at Student Health Services, and I'm a registered nurse as well. I've been here over 15 years. And so we were super excited when we moved from Alberg Hall over to the new Student Wellness Center in the YMCA. And we had like orange cabinets in our exam rooms. I mean, it was like super 70s, 80s vibe in there, and it was not pleasant. And so we had this brand new facility, and we had all these extra rooms to do things in. And then 2 months later, COVID hit, and then all the students went home. So we haven't gotten to quite see, you know, what our capacity could look like here until now. So, you know, COVID's kind of taken over our world over here. We see students. We don't see staff faculty here. We see student employees, of course. So anybody who's a student, grad students, returning adult students, whoever it may be, you guys all pay student fees. And so a portion of that goes to okay, my thing says, I just did all my updates this morning, and now it's saying it's going to restart me. So if I have to do that, I'm going to get on a different device. Anyway, so then you guys pay the student fees. A portion of that comes to Student Health Clinic. That's why we're able to provide our services really cheap, our medications, our lab services, any of the special events that we do. So like, I don't know if you've all heard of our P for Pizza, but it's a free STI, sexually transmitted illness testing event where we test students for gonorrhea, chlamydia, HIV, Hep C, syphilis this year anyway. And so those student fees are very helpful, and they also paid for this nice facility that we have. Right now, when students come to see us at Student Health, we have them call first. We're trying to control the amount of students who may be sitting in the waiting room at one time, maybe to give everybody more of a social spacing that's adequate for COVID purposes. And then we'll get you into appointments when you call, or talk to you a little bit and see if we need to call out medicine or whatever it may be. We have you put on a fresh mask when you come in, wash your hands when you come in. We have a sick area that we've designated for students who are there for possibly COVID-like illnesses. And then we have a well area. We share our facility with counseling and prevention services, but they are doing all of their counseling through Zoom and different virtual platforms. So their students aren't actually in our facility. So it's mainly just student health services students that are there. A typical office appointment can run anywhere from $30 to $35, depending if you're a new student or an existing already established student. Sometimes extra things cost a little bit more, so like physical exams. There's lots of programs out there that require physical exams. Your College of Education students, we're going to need a physical exam and a tuberculosis test when you get to the point where you start getting into the classrooms. Your College of Health Profession students need physical exams and tuberculosis testing and lots of immunizations. So we do all of that, but those could be a little bit extra. We draw blood all the time for many different purposes. We have COVID tests, we do strep tests, flu tests, lots of lab work. And then we have our institutional drug room, which is actually our kind of form of a pharmacy. And we're not a retail pharmacy like Walgreens and Target and CVS, those kind of places. But we have prescriptions like antibiotics, antivirals, creams, ointments, different things available for whatever student purposes may be. And then they have to see a provider to get the prescriptions, but anybody can walk up and purchase over-the-counter medicine. So we're doing a marketing push right now so that students, if they want to purchase any of our over-the-counter medications, they can call ahead, and then we'll get it ready for them and then bring it out to their car. So some curbside services to go along with some of our other services. So we take cash, credit, check, we put any kind of fees that may incur on student accounts if they can't pay right at the time. We don't turn anybody away for lack of payment. We take health insurance. Right now, we're in-network providers for Blue Cross Blue Shield, Aetna, United Healthcare, and United Healthcare Student Resources, but we'll still file insurance for all the other insurance policies out there. We just may not be in-network. We're working on getting in-network with Cigna and a couple of other policies right now. So that's a small, very quick push of our services. I'm going to open it up for questions at this time, if anybody has anything they want to ask.
I guess I have a question. So you said that you do some over-the-counter medications.
Mm-hmm.
What type of medications do you guys typically keep on hand?
We have it on our website, and they could be anything from like allergy pills. So we have right now Claritin, Allegra, Alavert, Cetirizine, and Xyzal. And then we also have lots of different creams like Differin for acne, benzoyl peroxide for acne. We have Miconazole for fungal or yeast and type rashes. We have hydrocortisone, ibuprofen, some migraine medicine that's over the counter. So it's kind of something where you can get on our website, wichita.edu/SHS, and you can look up and see what medications we have currently that you can get over the counter. They're really cheap, like a 30-day batch of Allegra is only, I think, $10 or $12. That's not bad.
No, that's actually really good compared to what it's selling for at the pharmacies right now.
Oh,
that's
I know,
awesome.
It's really bad. And you know, you don't have to see anybody. You can just walk in, or you could call us, like I said, and ask for curbside services and see if that works. I'm going to get my laptop ready because it's going to kick me out here in 9 minutes.
Oh, and then
Sorry.
So I guess another question I have is, if it's a service that you guys don't offer there, do you guys have like a referral program with other networks within the community? Because a lot of students don't have health insurance, or they're still on their parents, or and it's hard to find stuff sometimes.
It is, and we work with a lot of different facilities. We kind of know the ins and outs of different community people. The problem with working with a state institution like this is that you have to have contracts made, and not all facilities want to do contracts. And so we have some institutions around town that we tend to use whenever we need to refer students. So like, we don't have x-ray services currently, but we know that the immediate care through Via Christi down on Murdoch Street behind Wesley Hospital, they're really good about knowing our students. They like to walk in. And so they allow the students to walk in anytime between 8 and I think it's 6. And then with it being a Catholic organization, they tend to write off a lot of things. And so we tend to send the students a lot there because A, they can go in between classes and go in they need to, and B, a lot of times if they don't have health insurance, an institution like Via Christi will go ahead and just write off pretty much most of the whole entire charges that incur. Same thing with, we have different specialists around town that we send students to. So maybe some diabetics, we might send them to Dr. Martada here in town. He came and spoke to us and gave us a bunch of information and pretty much guaranteed us whenever we could call with students who need to get in, he would do his best to get them in as soon as possible, knowing that they're students, and they tend to write off stuff too sometimes. So those are the kind of relationships we've built in the community. And then for our P for Pizza, another one of our community collaborators is Positive Directions, and they work under the Ryan White Project for free HIV testing. And when they started doing free gonorrhea and chlamydia and all of that, they said, hey, we'll just do all of that for you for free. And so students come in for P for Pizza and get 5 free tests that ordinarily in the community is going to cost them $400 or $500 easily. So those are the kind of community collaborators that we work with. Is that kind of what you were asking me?
Yes. Oh, yeah. No, that's amazing. I mean, you guys kind of like a one-stop fits all. And then when you guys can't do it, you have those amazing connections for students still to get those services at a very reasonable rate, it sounds.
Yeah, it works pretty good. And then You know, we have specialists that come into the clinic. So we have an ear, nose, and throat specialist that comes in, and he pretty well, he works pro bono. You know, he sees students that we refer to them that might be a little bit more of a chronic situation that we can't necessarily do, you know, the best that we can with them while they're here with us. So we have him come in once a month, and he sees students, and if they need a procedure or something, he takes them down to his clinic and he'll do them there, and usually he does them for free. Just depends on the situation. So those are the kind of people we like to work with.
Yeah, no, that's amazing.
You guys have any other questions for me?
Yes, I have a question.
All right.
I just recently visited a student health. I think I've only maybe visited one time before. I'm a returning adult student that's also disabled. My form of insurance is Medicare, the federal
Oh, yes.
combined with Medicaid, and it's up under United Healthcare. I was just wondering why, like, that you guys don't take that insurance. I mean, I realize that the students and stuff usually aren't in that situation, but there is a population that actually is. And us being students on campus, we can usually get in quicker to see you guys.
Yeah.
And we can't waiting for an appointment and stuff like that without having to use the emergency.
Yes. Well, let me give you an example. So Medicare has certain standards that every facility who wants to file Medicare claims have to follow. It could be very expensive. So the facility has to meet certain guidelines. You have to do this in order to get reimbursed for this. You have to do this to get reimbursed for this. In that kind of situation, it would get to the point where our cost of services would go way up to accommodate for those requirements in order to bill Medicare and Medicaid. And we typically, when we've done our insurance surveys and things like that, we have a very small percentage of students who are using Medicare, and maybe a little bit higher number for those students who have Medicaid. And so our fear is that the prices would get so high that a non-insured student who can't get Medicare, Medicaid, or any other insurance, we can't equal that out because a majority of our students don't have any insurance. Does that make sense?
And I really appreciate you explaining that to me, because I like my insurance is, you know, under the umbrella of United Healthcare. And even when I was working, this is probably the best insurance I've ever had.
Oh,
and
good.
I remember like one time I wanted to get dental services, and I had like $3,500 worth of dental services. I mean, just period that I can get done, including like the regular stuff that you go in for. And
Yeah.
I was like, oh, wow. So, you know, I was like, I'd rather just go right here, you know, where I am.
And then you never know, it may be that that's something we can get into when we see that there's maybe a level of the cost versus the services that, you know, and what students have for coverage. But we do work with Health Corps a lot. Down the street, I don't know if you've ever used their services, but they have dental. And have you used them before?
No, but I'm thinking about actually changing my services from Grace Med and to them.
Yes, because they have a really wide variety of services available, and they do file Medicare and Medicaid.
Yes.
And they have dental services and all of that in play there. So not that I'm trying to not to want you to come see us, but I understand, you know, money rules the world, and we understand that. And so, you know, I want you to go where, you know, you can get the best benefit, but that's kind of where we're at with the Medicare, Medicaid. That doesn't mean we won't in the future look into that. But yeah, that's kind of the best explanation I can provide.
All right. Well, thank you, Heather. I appreciate that.
You're welcome. Any other questions? I have 2 minutes and 12 seconds, and I'll either have to get on my laptop through your Zoom, or if you guys want to email me privately because you have something very significant you want to ask me, I'm all for that too. Anybody?
Will you guys be part of the Wesley that's being put in there, or is that separate?
That's separate.
Okay. I didn't
And
know.
yeah, and as of right now, we're not sure what the situation is with that. So yeah, it's separate. But when it does open, they do intend on having X-ray facilities. So that would be so great for our students.
Oh
Now,
yeah, they can just go right next door.
Yeah.
so is that like going to be, I can't remember, I just came in there, what did it say, like an emergency room, or is this going to be just like emergency care? Like,
No, it's
you know
going to
what I'm
be more of like an urgent care. Have you ever gone to any of the urgent cares in town
Yes,
where,
urgent care. That's what I meant to say. Yeah.
yeah, that's what it's going to be. You know, there might be some mild wound care, like maybe some suturing and things like that. They'll have x-ray. I would kind of compare it to, there's a clinic over on North Rock where they have x-ray in the laboratory, and then they write prescriptions for people. And it's kind of along that lines. They'll have very limited staff, but it'll be more of an urgent care setting. And that was created more to accommodate maybe staff, faculty, innovation partners, because those won't be discounted services like ours are for students. It'll be more, you know, regular price stuff. So,
Okay. So
good question.
will they take my insurance?
I would assume that they probably could.
Because they're Wesley. Yeah, they do.
Yeah, so but you know, like I said, I have no idea when they intend on opening. I mean, there's nobody over there right now, so.
Okay.
Yeah.
And your facility is nice.
Isn't it though?
It's
It
a
is
lot
nice.
nicer. You don't have to climb a
It
bunch of
is nice.
stairs.
And all of the students, what we're seeing right now for, you know, cold and respiratory and COVID.
Mhm.
Oh, she got cut. I'm sure she'll come back. It was her computer
I'm
was
sure she's
restarting.
coming right back. Yeah,
I'm sure she is.
pretty interesting.
Yeah.
Yeah.
So until she comes back, I see that we have a couple new people on the
I
Zoom.
know.
Yeah, I'm very excited for that. So Natanya had suggested that we do like a small, like little icebreaker when we were doing our tabling event. So I guess something that would be really easy would just be like a word that's associated with the first letter of your name. And I guess I can go first unless somebody else wants to go first. Okay, so I guess my name is Heather. I am a senior this year. I am studying in psychology, and a letter that associates with my name would be humble. So who wants to go next?
I'll go. So my name is Natanya Ordonez. I'm a junior this year, studying pre-dentistry, and a letter that associates with my name, I don't know, nice. I'm very nice. So.
I agree. You are super nice.
So sorry. Okay. Does anybody else have any questions for me?
Did anybody else have any other questions? Or Kathy, did she answer the question you had right before she got cut off?
Absolutely.
Oh, she did.
Absolutely. I would like your email address though, because I have a question I would possibly like to ask you privately.
Yeah, absolutely. So
Sure.
it's just heather.stafford@wichita.edu, just like it is under my picture.
Gotcha.
Yeah. You know, I just want to bring up real quick our patient portal, My Shocker Health. You can get to the patient portal through wichita.edu/SHS. And I think that's a good resource for students because if they're virtually in classes all day long, they can still log into our portal and ask a health related question. So maybe they just don't have time to make an appointment, and maybe they don't need an appointment, but they just want to ask something. Then that's a good way to reach out to one of our healthcare providers and somebody will answer them and see if they need an appointment or what they need to do at that time. But it's also a good way to, we can send lab results through the portal, immunizations, we can send letters, whatever it may be that the student needs. Most times we can do it through the portal in a way that is virtual. Maybe they're not even in Wichita, but also in a way where some people are still afraid to go into healthcare clinics if they're not sick because they're afraid to get COVID. And that is a real realization. You know, we are testing students often for COVID. And so using the portal is a good way to maybe avoid those situations they're not comfortable with. So.
Awesome. And so they can set the portal up even before they come in to meet with you guys then?
Yeah, so as soon as they're in, you know, even an actual student who's admitted, they have their WSU ID and password, they can log into the portal and, you know, just ask questions. I mean, we had lots of questions from students who were new, who weren't starting school until August, but they had questions about COVID, or they had questions about immunizations they needed, whatever it may be. So yeah. And the portal's already there. You don't have to set it up. You can just go in. You can enable text messaging. So let's say you did make an appointment with us, then you can enable the text message feature. So you'll get a text message the night before saying you have an email from student health, and the email reminds them of their appointment. And then it'll also send you a text 30 minutes before your appointment. So kind of a reminder feature that goes along with being in the portal and engaging in that virtual way. So. And don't forget to watch our Tuesday talks on our YouTube channel. We have some really good information on there. Yeah, and I think it's really benefit to a lot of students because there's information for new students. There's information for, we spent the whole month of June for Pride Month doing a lot of LGBTQ conversations. Right now we're doing a mini wellness fair. We used to do a mini wellness fair on campus in September. So new students would kind of see all the health related resources. And of course, there's not a lot of in-person events, so we're doing it virtually through our Tuesday talks. And you can find our YouTube channel, our Facebook page, and all that stuff on our website, which is wichita.edu/SHS. And you can enter the portal through there. You can find out a lot of information on our website. So thank you all for listening to me. And I gave you my email, so if anybody has any personal questions, you can reach out to me. Okay?
Thank you.
Awesome. Thank you.
Thanks, guys. You guys have a good day and a good weekend.
You too. Thank you.
Bye.
Bye. Okay. Kathy, do you want to go next?
Yeah, I was gonna go. Here we go.
Okay.
So I can't think of anything to start with the name K. So, but I can. But I mean, like, wow, does it mean anything? My name is Kathy Johnson, and I am a graduate student at Wichita State here. I'm not sorry, of course, it's Wichita State. I'm in the master's program, and I just graduated in May. I'm only getting ready to walk in October, so I'm really happy about that. And the thing that associates with I'm the former president of this organization, and the thing that I associate K with is Kool-Aid. Now.
I was going to say kind.
Oh, kind. I was going to say kangaroo. And I'm a little wacky still. And so nice to see everybody. Nice to see new people as well. So I can't wait to hear about you, Naira.
Yes.
Yes. Hi, guys. My name is Naira, and I guess something that starts with the letter N. Novel, I guess. I like to try new things, and I don't always get to, but I do like to try new things, and I actually do like reading, so novel. Yeah.
What's your major?
My major is psychology. I'm not entirely sure in what specific area I want to focus on, but I do like psychology as a whole. So
Nice. And then we've never met you before, so I did get your request to join the organization, so I'm super excited that you have found us. Is this your first year or?
yeah, I'm a freshman, and I just found out about you guys from Natanya, actually. I met her at the fair that happened recently, and I was just very interested.
Yes. Nice. Well, welcome.
Thank you.
Tara, do you want to go next? Or Nelson? I don't know if Nelson's just listening or.
I didn't mean to put a thumbs up if that was me, unless that, I don't know, my screen had 4 people here, so I don't know Maybe it was Kathy. But I'm Tara. I'm a senior this year. I'm majoring in exercise science with a minor in psychology. I find psychology very interesting as well. And then something to go with the letter T, I would say trusting. I would say trustworthy, something along the lines. Yeah.
Guess it's my turn. How's everybody doing? Anyways, I'm Nelson. I'm the academic advisor for this group. I work in student support services on campus. Well, kind of on campus, mostly at home now. Something that starts with N. Say I'm a nerd. I like that one. Nerdy. I guess you can't see it, but my entire room's covered in superhero stuff. That's why this background is on.
Did you see the shocker blast of calling all nerds? They're trying to start a fraternity together. Did you
Oh
see
yeah,
that?
I did.
I thought that was super cool. So I have welcome everybody. I just have a small PowerPoint. She pretty much covered all of it, but it just pointed out a lot of the different services that she was talking about. And I'll share that real fast. So our topic this week was self-care, and I think it's really important, especially in times like this. We're just so socially distanced from everybody, and it's a new time. But school in general is stressing on top of everyday life that gets thrown at you in the mix, and you just kind of catch the pieces as you go. So my inspirational quote for the beginning is, "You wouldn't let this happen to your phone, so don't let this happen to yourself either," because self-care is a priority and is not a luxury. And I think Kathy has been the motivation for this one for me, because she took her summer to clean out her garage and just do a lot of things for herself as she prepared into her new role as a grad student. So congratulations, Kathy. I'm super excited for you. And then the counseling services and the student wellness services. These are a lot of the things that she had talked about, but then there's other services on there. With the counseling services, I couldn't get a hold of anybody to guest speak for that one. So I'm just really grateful that we had the Student Wellness Center there in general to discuss a lot of things that I guess I didn't know that they had either, with the whole over-the-counter prescription medications and stuff. And so these are things that they offer there. Their website said it was a $10 fee for the counseling services. I'm not 100% sure if that's accurate, so I guess you would have to just call and ask them. But if you ever needed mental health services, they are there for us as students. And then, of course, the Steve Clark YMCA. I have found that a lot of people don't know that students receive a free membership with enrollment. And if you happen to be a student who also has family, like children, or you're married, you can turn your student membership into a family membership, and it only costs you $22 a month, which is a huge savings, because it's $59.50 for a family membership, just for somebody who's going in there. They have group classes. They have personal training. It does have a fee. I was told that there is a discounted rate, though, for students if they did personal training. I don't know how much their rate normally is, but of course, the Steve Clark guys over there, they're amazing. There's always at least 2 of the personal trainers, and they have helped students figure out how to use weight machines separately, without charging them, because they're there to help support students as well. And then, so
Question on that last line.
Yeah.
So isn't it for all YMCAs as well?
Oh yeah, no, it's every YMCA. And then if you travel out of town to another state and they have a YMCA, you can get a guest pass before you leave. If you know that they have a YMCA there, they'll give you a guest pass, and it's good for up to a month.
Oh, that's awesome.
Yeah, and so students don't pay a joiner fee either.
Oh,
because
nice.
when you become a student, they pay that fee for you. So that saves you $50, I think is what it is right now. 50 or 100 is what their joiner fee is, depending on.
Expensive.
It is expensive. And then self-care was just our topic for this week. You know, it's really important. I kind of wondered, what does everybody do for their self-care time? Or do you do self-care time, I guess?
I mean, maybe take a nap. Not very much. I'm just tired and I want sleep.
Naps are good. I love naps. I've been doing this
So
taking a walk thing because it's been so nice out.
I've been wanting to take a walk too. I really need to. I did some volunteer work, which that's not really the self-care for the 9/11. They had the drive-through resource. That's well, I volunteer for self-care. No, anyway, man, I could swear I lost like 5 pounds just seeing people, even though everybody was masked and in cars, but it was outdoors. I thought I was just gonna jump like Superman or something. I felt so good to be outside just doing something. I was just like, yes. But I haven't got around to that, but I'm thinking about it seriously. But I'll binge watch. I'll binge watch something for self-care. You know?
I do that too.
And weirdly enough, like Heather was saying, organizational stuff is like big self-care for me because I don't really like to see everything like, oh, you know, like this, that, and the other, you know. So I also had a project with my bedroom and my jewelry and my hair things are all jewelry, hair things, lotion. Bought these little cabinets to put them in and stuff like that, and doing laundry. Believe it or not, I don't know. It's like therapy.
No, I agree. It is. I think it's just because like your to-do list is getting smaller, so it's like the small victories, they make you feel really good.
Yes. When I like plan out my planner for the week, I'm just like, oh gosh, I have a lot of stuff to do. But when you get to the end of the week, you're just like, I made it. I got it all done.
I guess it's a weird self-care thing that I do is I put everything on my calendar so that way I'm not scrambling at the last minute. So I tried the planner, I tried writing it down. It doesn't work for me because I'll add things and I'll forget to add it to the notebook. If I just do it, put it on my phone, it keeps me organized and which reduces my stress. So to me, that is self-care.
Yeah.
I do because we have some new faces. I want to share our art exhibit that Kathy worked so hard to get. So this is our first annual art showcase, and we're still taking submissions up until the 21st of September. It's posted to our website. I know Natanya has sent this out on all of our social media pages and in the storylines. I have it in Shocker Blast. If I know Kathy is very passionate about this. Very exciting. Kathy, are you going to do anything?
This was something. No, I can't even draw a stick, man. But this is something suggested to us from the director of McNair Scholars and everything, who's also a member of the first generation coordinating council and stuff. And so I had help, thank God, with Marco. Basically, he is like the director from art department, and so he helped us put this together. We applied, we did an interview, just the whole 9 yards. It was a lot, you know. And it's this is basically going to be like a beginning thing for the First Generation Students Organization and the First Generation Coordinating Council. So this is kind of a big deal that to have our name connected to, and that we actually spearheaded and took the initiative on. So, you know, we've been getting some things done, and we're looking to do greater things in the future.
Yes, and I'm super excited. It's all media, so the sky's the limit on this.
Yeah, and it's going to be held the first. Well, basically, it's held before November the 2nd. That's our beginning of that week. Is for National First Generation College Student Week or something like that. You know, so we're going to be like included in those dates when that week is being celebrated, and also the week before. So it's really exciting.
Yeah, no, it is very exciting. And
Wow.
I have tried to work on something, but I don't know. I'm like you. I can't draw anything. My mind's blank when it comes to art. It scares me terribly. And
I just
then,
can't wait to see the submissions and stuff. I'm thinking
yes.
about emailing Marco today and see if I can get a sneak.
So also for anybody new, we have lots of different ways to connect if you haven't already. I know if you got a flyer from the student involvement event that we did, it has them all on there. I just wanted to show you guys this again. That way you can stay up on all of them. If you have any of them, because I know Natanya, you send out the same thing to all of them. So if it's overwhelming to have so many platforms of social media, we're on all of them. Thank you, Natanya. And during our first gen week, like Kathy was saying, this is all new for us. So the art gallo is so new and it's super exciting. And I hope that we can continue this. We also planned to do a first gen event on the, correlating with that. So that way we really get our presence out there. So we are going to do a cocoa and bake sale event. It's going to be for the first week of the art gallery. And then for the second week, we're also going to be out there. I have several volunteers already. The only thing that we're missing is the October 30th. I still don't have 2 people to help with the table. We're going to be able to take credit cards. We have a machine that we have set up with the marketplace on WSU campus. So we get the card reader and iPad. She'll preset all the amounts in there. So all you have to do is click on the amounts of how many people buy and then just slide the card. It's super easy. It goes straight into our accounting. It clears up a lot of the in-between things. But again, we can also take cash. So if anybody is interested in volunteering, it's just going to be hot water is going to get poured into a cup for students, and then they'll get a packet of cocoa and they can mix it themselves either right there. We have to keep everything individually packaged. We've already talked about, the types of things that we're going to sell. If you are interested in donating any baked goods, of course, that is amazing. You don't have to, so no pressure, but it would be awesome. I'm going to do cookies, Rice Krispie treats, those types of things. Something that's easily packaged individually because of COVID restrictions. We have to do that. And then we'll have to package the stir stick and the cocoa packages to, individually as well before the event to reduce transmission of touch on items. Does anybody have questions on that?
With like packaging and stuff, like how will we be doing packaging? You know what I mean? Like if we have a cookie, we just gonna put like one cookie in a baggie, or like depending on like size or what kind, or
I guess it depends on whoever is donating the item. If you like, let's say you bake chocolate chip cookies, and so the items are $1. So if you do it individual, I kept it easy because $1 is easier for a college student to come up with. If you make chocolate chip cookies, if you break down your costs, like you are making money off the product. Again, these are donated, so it's not like it's costing the organization money. So I advise that you bake according to what you think your product is worth, because if I sell it for $1 and it costs you $5 to make, I will be very grateful that you put that much time and energy into it. And I know the organization will be too, but I just don't want you to feel like we're underselling items when you could get more for it. This is just our first event, and I hope that it's successful so that way we can do many of these. And Janae had talked about working with Chick-fil-A or Chipotle and setting up kind of like one of those days where you come and like a percentage of the proceeds go to the organization. I don't know where she is at on that, but I told her, I said, I have no idea how to do that. If you want to do that, absolutely.
Yeah, that'd be awesome.
Yeah.
So are they just going in like Ziploc baggies, that kind of thing? Okay.
Either Ziploc baggie, saran wrap, something that you can make it to where you just have one exchange versus multiple exchanges.
Gotcha.
Yeah.
Mhm.
So I just wanted to add, my son has owned Southeast Carryout, and it's always been like we've never had a chance to do it, but he has always made it open for us to get 10% of the profits. We can do it like in a certain segment, but he's actually going to, we don't let everybody else know, but he's at, well, maybe we should. He's actually going to donate 10% of the profits for the whole day.
Oh,
So yeah, because he's my son.
yeah.
And I'm sure that he's still doing that. I mean, he has suffered a loss during the pandemic, but it's been a loss. Then now he's like really kind of on track, you know. So
Mhm.
he never really kind of opened. I mean, we can maybe do some type of advertising. I mean, he never actually closed because it's a carry out, so there really weren't a bunch of tables anyway, you know. But yeah, so I just want to let you know that that is still an option.
And that is off of Harry and Oliver,
And
is that right?
yes, it is next
Oh,
door
okay.
to what used to be Payless, but is now the shoe show, and it's
Yes.
still getting my money. The shoes are more expensive and still getting my money.
No, I think that's a great
Yeah,
option, Kathy. If you want to talk to him, of course, I
I
don't want to
will.
impose on him because of the
Yeah,
COVID and how it's affected a lot of people. So if
yeah,
he's open to doing something like that, I'm sure we could put together some
sure.
type of flyer or something, because that will also
Exactly.
attract business to him too.
Exactly. And then by it being like an all day thing or whatever, really,
Hmm.
close. Because I'm pretty sure that was I'm pretty sure he'll still be willing to do it because he likes to give. And
Hmm.
I think that's one of the reasons why his business has stayed open because in the pandemic, he just upped his giving,
Yeah.
and donations and stuff like that.
Mhm.
So, it kind of comes back around like that. So,
No, that's awesome.
yeah. And
And then
all his burgers are like fresh meats. He changed when he got it. He changed the meat to being fresh meat. He's invented several burgers, so you might want to look up Southeast Carryout and check out some of these wild burgers that he has.
it's been a while since I've ate there. They used to be over by Southeast High School in the
Exactly.
Po' Boys building. I mean, that was a long time ago, but
Well, yeah, that was even longer than that because then it was like right across from Southeast. Now, when my son, who is, I guess he's 45 or so. Anyway, he's so old, I don't know how old he is. But it was his first real job. So we lived
oh,
right in those apartments right down the street and across from Southeast where he went. And him and the owner, Andy, were always stayed friends all of these decades and stuff. And so when Andy really wanted to sell it, he really actually wanted to sell it to Perry.
oh wow.
Yeah. So and then when Perry couldn't get the financing, and then Perry's had already been writing business plans that were getting rejected for opening up his own restaurants and stuff. But he started there, and then he ended up like the GM of Golden Corral and also Who Hot and stuff like that. So he worked his way up from like the little burger guy.
No, but that's so
Business
awesome though.
owner. Yeah, actually busboy to business owner. So I just love my child. So I can go on and on. Let me stop. But yeah, the food is good and it's fresh. Everything he's cooked fresh. The fries and all that. None of this already pre-made stuff. Although, well, not although, but I must say that the special that probably you ate and anybody else that has actually eaten there, which is the double cheeseburger special, is still on the menu. It just has fresh meat and it's still the top seller. So,
Oh, thank you so much for coming. I know you've got another meeting, Naira. I hope to see you again at more meetings. Email us if you have any questions too. Like we all have ability to help you out.
Well, thank you so much, guys, again.
No, thank
nice
you.
meeting you.
Thank you.
Before you go, next
Uh-huh.
meeting we have an in-person one and it's in the RSC, but we also have a Zoom availability. But I was going to talk about it. I don't know how you guys feel about this. I was going to a pumpkin patch today and I was going to see if they'd give me some small pumpkins kind of at a really good cost, but we could paint them at our next meeting.
Ooh,
Yeah.
be fun.
Okay. And then the care team is going to come. So I'm going to see if she will donate like the paint like they had for the Style Your Tile
Yeah.
event.
Mhm.
Yeah.
That'd be
Who's
cool.
the care team?
So we have a care team, and it's what is her name? Riley and Natanya, do you remember the ladies' names?
Alicia Newell, Vaughn Sweets, or not Vaughn Sweets. It's not.
All of those names
It's-
sound familiar.
They have been to one of our meetings before. You had it at the end of the semester.
That's why. Oh, Vaughn Sweet was one of our presenters. Well, no, she never did quite make it, but yeah, I think she was with Northwestern Mutual or something like that. Or I can't remember. But anyway, maybe she was one. I think she was one of our presenters at one of the very first meetings, actually the first meeting.
If I find her, I'll look at her name.
It's
When I'm
right.
on the Zoom and it's recording, it doesn't let me pull up other things. Sometimes it's kind of picky. If I find her name, I'll just text it to you. In the group.
the care team is Alicia Newell, Tara Hannah, Ashlyn Riley, and Vaughn Sweets.
It was Ashley and Riley who did the Style Your Tile. Yeah.
But
So,
that does sound interesting.
yeah, I was thinking the pumpkin painting would be nice because it's close to Halloween because it's October, but our third meeting is Zoom. Unless we wanted to do a virtual pumpkin painting. I don't know how that would
No,
work.
we want to do it in person. We'll just get a big room and we'll just put ourselves on each end of, you know what I'm saying? I got to get out this house.
Okay, well then, okay, so I'm going today with my son and his girlfriend. I will see if they will be willing to donate some smaller pumpkins to us, or it doesn't matter. Like, we're going to have pumpkins and we're going to paint some pumpkins next meeting.
Sounds good.
So thank you so much for coming. We're actually
Thank you for
almost at the
having
end
me.
of our meeting too. Anybody have anything they want to talk about or share?
Join the group me if you haven't. I put the link in the chat.
Oh yeah, I do like the group me. That does keep me organized from the emails.
What time frames did you need volunteers for the 30th for the Cocoa?
So that one is, we're only doing it for 2 hours, so it's from 1 to 3.
1 to 3. Okay. I'll just talk to work to see if I can get my schedule worked around, and maybe I can do that. If anything, I'll try and bake some stuff.
Awesome.
I can work the 30th if I'm not signed up for anything.
Okay.
Because I think I'm only signed up for like the first gen check-in thing.
The first gen check-in, you signed up to host the table from on the 3rd, is it the 3rd of November for the first gen check-in, and you're gonna do the sign-ups and stuff? Yeah.
Real quick, Naira asked, when is our next meeting?
Oh, it
It's
is.
in 2 weeks, right?
Friday.
It is. I want to say it's October 2nd, but don't quote me yet. I gotta
Yeah,
look
I
at the
think
calendar.
it is.
Yes, that's the first Friday. So October 2nd from 1 to 2, and we'll be in the RSC. Why is my brain don't want to tell me what room number we're in? Hold on.
It's probably 261. 260
no,
something.
it's like a really weird one this time. Because it wasn't open. They didn't have like the 200 ones open. I have it wrote down.
Okay, well, we can get it when you send the,
It's room 264.
264? Okay.
Yeah. Awesome.
Okay, well, thank you so much. I have to go. I'm sorry.
No, it's okay.
Thank you.
Yeah, we're pretty much at the end too, unless anybody else has anything.
This was a good meeting.
Yeah, I'm excited for pumpkin painting next week. I'm going to reach out to the care team because they have the Style Your Tile stuff, and they had a bunch of paint and paint brushes. I can get paint at the Dollar Tree super cheap too, though, so it's not a big deal.
I can make an ad thing, like just like what I'm going to post on social media, and I'll send it to you, Heather. and you can post it on Checker Blast or wherever you send it to be posted on Checker Blast.
Yeah.
So it's all the same, if that makes sense.
Yeah, no, that's
Yeah.
awesome. Yeah. Yeah, because they said at our meetings, we can do activities as long as we socially distance, and then we just have to clean up after ourselves. So I think it'd be fun just to have an activity to do. I didn't have like really much to present anyways, because we have a lot of really great guest speakers lined up, but it's just kind of later. Like we have Kay from student service, from all that stuff. And then I was trying to get a grad student to come guest speak to us that's a first gen student, and she did a lot of research on imposter syndrome. And I think she actually did a publication too. I don't know if we're going to be able to line up our schedules together, but she really does want to come speak to us. She
That'd
thinks
be
it's
real
really
nice.
interesting. Yeah. So,
Yes, definitely.
yeah. Well, I guess everybody enjoy your Friday and your weekend. And then
Thank you.
I will show pictures of the pumpkins when I get them. I'll send you pictures, Natanya, and like I'll just send a picture of the pumpkins lined up, and then you can like I don't know, send them out on social media, but like come paint
I'll
pumpkins.
work my magic. That's what I'll do. I'll work my magic.
Yes.
Will you be sharing those PowerPoints?
You want them? I can send it to you.
Oh yeah, PowerPoint collect.
I'll send all the ones that I've done to you. I've saved all of them.
Nice. I appreciate that. Yeah.
Yeah. No, I'll send
especially
them
at that list and everything. I might have to try to check out that self-care list.
I just stole stuff from the internet, but there's things on there I never even thought that were even self-care type thing. I would have never thought binge watching TV would be considered self-care, because in my brain I'm like,
it is for me.
I need to be doing something else, but then it is therapeutic.
I really don't even mind either. I'm like when I finished those 2 conferences each night at 5, I just said, okay, I already had, there was already stuff they'd mentioned, books, of course, and no movies and whatever stuff. So I just sat and laid right on down and binge watched. Now I'm back on it today, though. So, yeah.
Great. I don't know if you've seen, are you interested, because you were a McNair scholar, too. Have you watched the documentary on Netflix about the Challenger?
No. Oh, what's the name of it?
It's called The Challenger.
The Challenger?
They just released it. I want to say it was yesterday or the day before. It's like a 4-part series.
Oh yeah, I definitely be watching that. Just real quick, when I was in school before, one of my advisors that last time I was in school was Ivana Spencer. She's no longer with us, but she was like with the university forever and ever and ever. And she's kind of start telling me the story about the McNair Scholars Program and his association with Wichita State, and as well as just the TRIO programs and stuff, because our TRIO programs have been going on probably since how long, Nelson? Since 1945 or something.
Sometime like after World War II, pretty recent.
Yeah. So, and so and I always call her Doctor. God, I forgot her name. Never mind. I'm talking about.
Miss Colvin.
Yeah, Miss Colvin. Yeah, I always call her Doctor because I figure with all the accolades and stuff that she has in building the TRIO network here at Wichita State, you don't have a doctorate? I'm serious. You don't have to have one, I guess. Yeah. So she was telling me about Ronald McNair and everything. So I definitely want to watch that.
Awesome. I think you'll really enjoy it. I watched the first 2 episodes and then I got busy, so I'll have to go back and rewatch the ones that just played in the background.
Oh, The Challenger, correct?
Yep. Mm-hmm.
Okay, got it.
Well, I'll see you guys later. I got another meeting to grab too.
Yep. No, I'm about to end it.
No, you got to stay here and kick it with. No, bye.
All right, guys. Enjoy your weekend.
Bye, everybody.
Bye.
Bye.
Have a good weekend. Bye.
Bye.